It's kind of like your bank account. Now you can keep depositing money into the account, but if you are withdrawing more than you deposit, then you end up in the negative balance. Hi, I am Dr. Odoi. I'm the founder and CEO of Oasis Women's Functional Medicine. We are a boutique functional medicine practice located here in Rochester, New York, and happy Women's Month to all of you. So this month is going to be focused on bone health, okay? And in this particular video, I'm going to be educating you about how bone is lost and how bone is formed and who is at risk for rapid bone loss and what you can do starting tomorrow to start getting to a place of strength for your bones. So our bone, I would like to think of it as an active organ. It is constantly remodeling, meaning that you have cells that are causing the bone to build and then cells that break down old bone. And so bone, as much as it feels very hard, it is a very much living and breathing part of our bodies, and it's constantly remodeling. And what happens as we get older during perimenopause and even menopause is that the bone breakdown process becomes more sped up, or it becomes faster than the building up process. So the breakdown becomes faster than the building up. And we start to see about 2 to 5% bone loss by the time you are in your mid-40s, at least, 5 years before menopause and 5 years after menopause. That real, that gap is like critical time to be very attentive to your bones. And I mentioned it earlier that, we have the cells called the osteoblasts, which build bone, and we have cells called osteoclasts, which breaks down bone. And as you get older, as you get into perimenopause, due to the decline in estrogen, the build-up process slows down, whereas the breakdown process is revved up. And estrogen plays a key role here by slowing down the breakdown process. So estrogen slows down the activity of the osteoclast. And so when you get into perimenopause and there is decline in estrogen, now because of that decline, those cells called the osteoclasts, which cause the bone breakdown, no longer have the brakes that estrogen used to place on it. And so now you have accelerated bone breakdown, and the bone is still building, but the breakdown is faster, and so then you end up with bone loss. It's kind of like your bank account. Now you can keep depositing money into the account, but if you are withdrawing more than you deposit, then you end up in the negative balance. And that's how bone loss is happening as we get older and as we go into menopause. The biggest issue with bone loss is not that we don't have the equipment or the tool to diagnose this soon. We do, but unfortunately, most women will experience a bone fracture before they are eligible to get a DEXA scan. Now you might be asking, what is a DEXA scan? It's a type of x-ray that we use to determine bone density. And right now, when you are age 65, that's when you can have your first DEXA scan. But 1 out of 2 women will suffer a bone fracture before age 65. And so the screening is happening after most women have already suffered a fracture. But that does not have to be you because you are listening to this video. There are also a group of women who are very high risk of bone fractures even before age 50 or even age 65. So which people are risk factors? One is women who experience early menopause, whether they experience menopause because they had surgical removal of their ovaries and therefore don't have any estrogen in the system early on, or they had chemotherapy and radiation treatments that destroyed their ovaries, so they are not able to make estrogen. So if you experienced early menopause, you are at particular risk of developing osteoporosis or osteopenia early on. If you have a family history, especially if your mom, your grandmother, your aunt, your sisters have suffered osteoporotic fractures of the hip or of their back, you are also at high risk. If you have low body weight, so women who struggled with eating disorders when they were younger, or women who just naturally have lower body weight, tend to have high risk for osteoporosis or osteopenia. Thyroid replacement or overthyroid replacement or hyperthyroidism. If you develop a disease called Graves' disease, then you tend to have a hyperactive thyroid, and high thyroid hormones accelerate the breakdown of bones, and so you are at a risk for developing bone loss. Steroid use. So if you have a history of asthma or Crohn's disease or ulcerative colitis where you've been on steroids, or you've had lung disease of some sort, or any disease that really you've needed to take steroids for a long period of time as a child or as a young woman, you are also at risk for osteoporosis or accelerated bone loss, because steroids can cause accelerated bone loss. The last group is people who have gut dysfunction for whatever reason. I mentioned earlier the ulcerative colitis, the Crohn's disease, any sort of inflammatory bowel disease that causes you not to be able to absorb nutrients such as vitamin D or calcium. You are also at risk. And so if you know someone or you belong to any of those groups that I mentioned, you should definitely reach out to your primary care provider or your physician or anyone who takes care of you and request and ask about a DEXA scan. That is the screening tool we have right now that will help us to be able to diagnose you with osteopenia or osteoporosis, which is basically bone loss and bone weakening. Bone loss is pretty predictable. Just to recap, bone loss is pretty predictable. We know it happens by your mid-40s, and we see accelerated bone loss by the time you are in menopause. And so because we have these facts, already known, it is so important that we are empowered to start taking care of our bones. And I'm going to come back next week to discuss different things that we can do to help make sure that we develop strong bones and avoid fractures in the future. And subscribe to the YouTube channel. This month is going to be all about bone health. I'm going into in-depth about nutrients and different strategies that you can use to build your bones. So stay tuned till next week. Thank you.